The aortic root is the initial, bulbous section of the aorta, the body's main artery, where it attaches directly to the left ventricle of the heart. It is a critical anatomical structure with three main components and functions. 1. Aortic valve. The root houses the aortic valve, which is typically tricuspid, having 3 leaflets. This valve's primary function is to act as a one-way gate, opening to allow oxygen-rich blood to be ejected from the left ventricle into the aorta during a heartbeat, systole, and then closing tightly to prevent the backward flow of blood, regurgitation, into the heart when the heart rests, diastole. 2. Coronary artery ostia. The left and right coronary arteries, the arteries responsible for supplying oxygenated blood to the heart muscle itself, myocardium, branch off the aorta immediately above the aortic valve leaflets within the aortic root. The openings where they exit are called the coronary ostia. This ensures the heart muscle gets its blood supply first, right as the blood leaves the heart. 3. Sinuses of Valsalva. The root is not a simple tube. It has 3 localized bulges just above the aortic valve called the sinuses of Valsalva. These sinuses are functionally important as they provide space for the aortic valve leaflets to open fully and allow for the non-turbulent flow of blood. The coronary arteries originate from 2 of these sinuses, the left and right coronary sinuses.
The ascending aorta is the first section of the aorta, the largest artery in the human body. Function and location function. It is responsible for carrying oxygen-rich blood directly from the left ventricle of the heart. Course, it rises superiorly, upward, from the left ventricle's aortic root. It travels obliquely upward, forward, and to the right. Contained within the pericardium, the sac enclosing the heart. Length. It is typically about 2 inches, or 5 to 8 centimeters, long. Termination. It ends where it curves to become the aortic arch. Key anatomical features. Aortic root, the very beginning of the ascending aorta, closest to the heart, includes the aortic valve and the aortic sinuses of Valsalva. Coronary arteries, the only branches that arise from the ascending aorta, specifically from the aortic sinuses, are the right and left coronary arteries, which supply blood to the heart muscle itself. Relationship to pulmonary trunk. The ascending aorta travels alongside and is enclosed in a common serous pericardial sheath with the pulmonary trunk, the large artery carrying deoxygenated blood from the right ventricle to the lungs. The aortic arch is a vital curved section of the aorta, the body's main artery, which forms a cane-shaped loop over the heart after ascending from the left ventricle. Its primary function is to distribute oxygenated blood to the head, neck, and upper limbs via 3 major arteries that branch off its superior surface. Major branches of the aortic arch. The 3 major vessels that arise directly from the aortic arch are, from right to left, patient's right to left, brachiocephalic trunk or innominate artery. This is the first and largest branch. It is short and immediately bifurcates, splits into 2 arteries. Right common carotid artery supplies the right side of the head and neck. Right subclavian artery supplies the right arm. Left common carotid artery. This is the second branch and travels superiorly to supply the left side of the head and neck. Left subclavian artery. This is the third and final branch which extends laterally to supply the left arm. The aorta overall is divided into 3 main sections. Ascending aorta rises from the left ventricle. Aortic arch, the curve connecting the ascending and descending sections. Descending aorta travels down through the thorax, thoracic aorta, and abdomen, abdominal aorta. The specific branching pattern of the aortic arch is critical for ensuring continuous blood flow to the brain and upper body. The presence of the brachiocephalic trunk on the right means the right-sided head and arm arteries share a common origin, while the left-sided head and arm arteries, left common carotid and left subclavian, originate directly from the arch.
The descending aorta is the final and longest segment of the aorta, the body's main artery, responsible for distributing oxygenated blood downward to the lower body. It's a continuous, straight vessel that extends inferiorly from the aortic arch and is strategically divided into 2 main parts based on its location, the thoracic aorta and the abdominal aorta. Thoracic aorta. The thoracic aorta is the upper portion of the descending aorta, located within the chest, thorax. Path and location. It begins immediately after the aortic arch, descending through the posterior mediastinum, the central compartment of the chest cavity, until it reaches the diaphragm, the muscle separating the chest from the abdomen. Function. Its primary role is to supply blood to structures within and lining the chest cavity. Major branches. It gives off numerous smaller branches, including arteries that supply the chest wall, intercostal and subcostal arteries, the esophagus, the bronchial tubes which supply the lungs, the pericardium, lining of the heart. Abdominal aorta. The abdominal aorta is the lower portion of the descending aorta, beginning immediately below the diaphragm and traveling through the abdomen. Path and location. It runs along the posterior abdominal wall until it terminates, typically at the level of the fourth lumbar vertebra, by splitting into the two common iliac arteries, which supply the pelvis and legs. Function. This segment is vital as it provides the major arterial supply for all the abdominal and pelvic organs, as well as the lower limbs. Major branches. It gives off large paired and unpaired branches to the organs. Key examples include celiac trunk, an unpaired branch supplying the stomach, liver, spleen, and parts of the pancreas and duodenum. Superior mesenteric artery, SMA, an unpaired branch supplying the majority of the small intestine and the first part of the large intestine, cecum, ascending colon, and part of the transverse colon. Renal arteries, paired branches supplying the kidneys. Inferior mesenteric artery, IMA, an unpaired branch supplying the majority of the large intestine, descending colon, sigmoid colon, and rectum. Gonadal arteries, testicular or ovarian arteries, paired branches supplying the reproductive organs.